like to use chapstick because I like to grease my lips. Welcome back. So one of the things that commonly I'm getting a lot of in the last 2 years is rib removal. This operation, I love to do this operation because it shows the technical genius that we possess here at MiKO Plastic Surgery, okay? But safety concerns have come into question. And the question is it safe to remove your ribs? The answer is yes. And one of my beliefs, okay, that when people have their ribs moved, just like is it necessary to have liposuction? You don't have to have liposuction. You don't have to have a tummy tuck. So we can't knock people when they want to remove their ribs. Okay, when people remove their ribs, essentially what they are trying to do is they are trying to remove the barrier so that when they waist train, there are no ribs blocking the training, blocking the cinching of their waistline, okay? So this operation is a very simple operation. Actually, this operation in my hands, I think is much safer than liposuction because you can visually, if you're a good surgeon technically, you can visually make an incision as small as what, 2.5 inches, okay? Through this little tiny incision, you can remove 2 ribs, 2 of the floating ribs on each side, okay? I've done several of these, knock on wood, we've never had issues. Patients are extremely happy. You can have this operation today and tomorrow you'll be on your feet, you can go shopping, you can do whatever you want to do. And this is true talk, okay? One of the things that people always talk, don't you need your ribs? I always joke around that God made spare parts, okay? God loves us so much, He made spare parts. In my opinion, I think floating ribs are a little more dangerous. In a car accident, they can puncture into your organs, okay? We don't really need it, okay? Nobody knows why God made them. God has made several pieces of organs or several pieces of tissue that we don't need. The most common one is the palmaris longus. It's the tendon that is right here, this tendon right here, okay? Not everybody has this tendon. Okay, if you want to go home and do this, just kind of do this, and I don't know if the camera can capture it. I do have one, because I think God loves me so much. But not everybody has it. Okay, it has been reported that 15 to 17% of the population don't have it. My old boss at Harvard always used to joke around that God made spare parts. Okay, some of us are lucky to have these spare parts, and we primarily are harvested. This tendon doesn't really have a function. So what we did was we usually will harvest it to reconstruct other tendons, joints, and so on and so forth. So the same thing with the ribs, okay? These ribs are floating ribs. We don't need them. I think they can cause more havoc when in the car accident, when it breaks and it goes in and it punctures your kidney or your spleen. And removing it, if you find a surgeon who is safe, who is technically sound, meaning they know what they are doing, you know, there is no qualms about this surgery not being, not being safe. It is very safe. Like I said, it's safer than liposuction. And I hope I was able to answer some of the questions and put some of these things to shame. Thank you.